Achilles tendonitis, tendinopathy. We've made a number of videos on this already.
Very common.
Yep, and we're going to do a little update here. There's been a little bit of debunking going on in the world of
Controversy.
Yeah, with our treatment,
Right.
and so we're going to address that as well.
We're defend it.
Yeah, we're going
Right.
to tell you what we really think and what really works. So,
Our opinion.
good luck. Oh, stay around and watch us, though.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, Achilles, tendonitis, tendinosis, tendinopathy. We've got the Achilles tendon. There it is. One of the largest tendons in the body. It gets irritated from overuse, maybe from weekend warrior, getting that tendon to actually become painful, swollen. And oftentimes, when that happens, the tendon will actually get a buildup or a mass on it.
I've seen that
associated
many
with that. It can be very painful. It can keep you from walking. It can be painful when you get out of bed in the morning when you first put weight on it, and you need to get it under control.
So what should you do in bed, Brad?
Well,
when you first wake up.
That's very good. If you are one of those people that when you get up and you stand on it and you take that first step and you're limping, you're going to actually
do a little stretch.
Yep. Actually, you can just start out with some
range
ankle pumps.
Right.
There you go. If you want to give it a little more of a stretch,
you should actually grab onto it.
There you go. Yep. Just sit down. Now, I normally wouldn't be sleeping with my shoes on, so yeah.
This is a little more realistic.
Yep. Stretch it, and then you can actually give it a little gentle massage.
Right.
Okay. Now, this isn't the massage we're going to treat later with it, but just to get the blood flow moving. Okay. Number 2. This one's pretty basic, Bob. Avoid activities that irritate it. So if walking is pretty painful on it, I'm going to suggest you actually get a crutch or a cane out and take some stress off it.
Some people will put a little heel wedge just in the shoe on that side.
Right. Yep. So just a little spacer, like a piece of carpet.
Yeah, cut a carpet heel.
Yeah. I've used cardboard, layered up cardboard that fit just under the heel, and
it's temporary.
So raises it up, puts a little slack on the tendon, and it's temporary until it feels better, only a few days.
Right.
Because otherwise you got a leg length difference problem. Good. The next one, address the calf muscle.
If that's tight, it's going to put more stress on the tendon.
Right.
So you want to make sure this is loose.
And that may be the reason why you got the tendonitis, is because your calf muscles were tight. So we're going to show you a couple different options to do it. You can massage that calf muscle by hand, and that can work good. You may find a tender spot. I know on mine it's on the outside. It's going to vary on different people, but you're going to spend some deep tissue massage with your hands until your fingers get sore.
They fall off.
Yeah, if you can wear your fingers out. We're going to show you a couple other options if you have a massage gun or a 6-inch roller. Go ahead, Bob. Okay, if you happen to have one of these 6-inch rollers, you can start with that one. And it doesn't matter what density, usually a medium or a hard one. And like if this is my muscle and I go across and I can find, sometimes it toes up, you turn to the side, you'll find the tender or knotted area. Once you find it, then you're going to work on that. And if you need more pressure, because this is a little painful, but you'll know it's the right thing, is after about 30 seconds, it starts to feel better. You're actually releasing the tension in that muscle. You may go more aggressive by doing this, putting the good leg over the top and continuing to work it. You may do this 2 or 3 minutes or even more. If you have a massage gun, Bob's going to talk about that.
A lot more effective, I think, Brad. So I have found the massage gun is by far the most effective way to do this, Brad. I mean, it's really easy to do, easy on the hands, and effortless. So this is the EM19, by the way, which you could find in Walmart.
There you go. But this is something you've been doing for quite a while, right?
Right.
Yeah, because you got a tight calf thing going on.
So I do it before I exercise and also at night before I go to bed.
Right. Yep.
And it's got 5 different heads.
Yep. Well, 5 heads, they look all similar like this.
Right.
And the nice thing about this is you can use it for every part of your body, except for your neck. You're not going to use it on
back,
there's a
shoulder.
Yep, it works well.
Chest.
There you go.
One, don't you?
All right, next one. Okay, Bob, this next treatment, one that we've been we promoted it quite a bit over
Big
the years.
advocates
A
of it.
lot of success.
Right.
However, there's a little turmoil in the therapy world
Right.
with some studies that have been out recently, is that this cross-friction massage technique on the Achilles tendon is a big no-no.
Right.
However, I found a study in 2019, our previous video, that actually promoted the massage as well as the eccentric strengthening. We'll get into that. But Bob, you want to talk about your feelings on this?
Well, I mean, I have used this on hundreds of people.
Mm-hmm.
I mean, really, literally hundreds of people, and it's almost always been effective if they do it right.
You're right. I didn't read the study that
Study,
debunked it,
right.
but we just know from our clinical experience and anecdotal
Right.
experience. Now let's show how we do it.
Well, one thing, you don't want to go across the back of the tendon. You
Okay.
actually want to go on the sides of the tendon.
Okay.
Like you do a pincher grip.
Yep.
So you go back and forth like you're a saw, back and forth. And if it's really tender, you keep doing it, it gets worse and worse,
Yep.
you stop. It's too early for it.
And
Right.
we usually use that 20 or 30 seconds.
Right.
After that time, if it still hurts and is painful, you need to stop. It's not ready for it.
But if it starts to feel a little bit numb or better or decrease the pain,
Yep.
then you keep going. You can do 15 minutes a day.
Sure.
I mean, if you can tolerate that much.
I
Might
just
do
want to
5 minutes at a
emphasize
time.
for those people like me, if you've a little bit's good, you're not going to jump
Right.
into 15 minutes. Take your time, progress day to day, and so let's just look at that again, Bob. There we go.
Pinch,
Yeah.
back and forth saw.
Yeah.
And you're really pinching in there, really gripping down on the tendon and doing cross fiber massage.
Yep. Yep. Okay. Well, and we've had success with
Yeah.
it. We would not promote it if we didn't.
It's one of my favorite treatments.
Yeah. So just be careful with it. Make sure you don't overdo it the first day or two. Build up.
Yeah.
Okay. What's the next one, Bob? Walking.
Yep.
Hopefully you've got the muscle loosened up, you've got the circulation and the tendon less pain, and all of a sudden you don't need your cane anymore. You're walking pretty good. Do not jump into running
Right.
or high intensity yet. You need to progressively build up. You can do your walking. When it starts to get painful, you stop. And then we're going to get into strengthening next. Strengthening, Bob. What's the word for starting out strengthening? Starts with an E.
Eccentric.
There you go. Yeah. So a nice set of steps works really well for this, just like we have here. If you got handrails, you're in what do we call it?
Heaven?
Heaven. There you go.
Hog heaven?
There you go. Exercise heaven. Now we want to do eccentrics to get this muscle and tendon strengthened again, because we're actually strengthening that tendon as well and getting the fibers lined up doing this. Start up here. Now I'm going to take my healthy leg and go down and slowly go down. That's the eccentric. Go down as far as comfortable. You may not be able to go down all the way. Other foot goes on, lift up. The way up, there's little to no.
So you strengthen as you lengthen.
Strengthen as you lengthen. There you
Right.
go. There's two. Am I going to go up?
Right.
So you get the idea. And you need to have a pair of shoes on so you grip to the
You
steps.
grip well.
Yeah.
And by the way, I need to point out, Brad made these steps. Isn't he handy?
Oh, well, Bob, it's just one of those things. It's a kind of a curse.
Amazing, Brad. Yeah.
Yeah. Well, it was a
It's
nice
a blessing
project.
and a curse, right?
So when you can do 10 of those, and it's not painful, things are going good, then you can progress to both feet up and down.
Sure.
And-
Concentric and eccentric.
Right. The goal is that you get full range of motion down without pain. You may start out in the neutral position, again, same with the eccentric concept, and work that. And as you do this, you're going to find walking is getting better. If you're a runner, you're going to start out jogging, maybe jogging, walking, jogging, walking. And for those people who are high-end athletes, maybe doing some
Right.
jumping, anything that is more aggressive, tennis, soccer, etc. We're not going to get into the advanced strengthening, which we do have videos
That
on.
would be another video.
Yeah,
Right.
we have some videos, Bob and Brad, on ankle strengthening for the athlete, I believe is what the name of it is. You'll see it. Google it in, and many alternatives will come up. And once again, Bob, I think this does fall into the,
We can fix about anything
Except for-
a broken heart.
yeah.
It's on this side, right?
Is that far over? Yeah, that's good enough. That's
It's
close
close to
enough.
center.
Yeah, we just had a nice video on heart attacks, so but that's another story.
How pleasant, Brad.